myself and Emma, we like to challenge ourselves all the time, and this seemed like a very challenging piece of work to do on actually, what would an evaluation framework look like for institutional health partnerships? And so, really, what we want to answer in this short session is why develop the tool, how was it developed, what does it look like, and hopefully you now have a copy of this tool, and what does it do? I think, again, as Andrew already said, there has been some cynicism, particularly amongst donors, about the effectiveness of this model and this approach. And certainly when we first started getting involved in this type of work, people were saying, well, do partnerships actually work? Does this approach work? How does it work in comparison to other forms of technical cooperation? Is it as effective? Is it better? What does it produce? And do the benefits last? And those are very important questions to funders. And I think for those of us who do believe that this is a good approach, then we need to be able to find ways of providing the evidence so that if we can provide the evidence to funders and answer these questions for them, hopefully there will be more funding available for this kind of approach to working. I've been involved in development for quite some time, and I think looking around the room, many of you have as well. And I think one thing we know is that projects come and projects go. And actually, it's not enough to have a successful project, which produces, yes, some good short-term results, some very nice, encouraging results. What we're really interested about, and this is what Jonas said a little bit earlier from Misao in Mozambique, is about how do we sustain that change. That's what we're really interested in. So we have to go beyond those quick wins. And then how do we distinguish, I think for bodies such as the Esther Alliance, for THET, how do we distinguish those partnerships that really are bringing about that lasting change? And this is really the backdrop for why this tool was developed. So yes, we want to be able to give answers to the donors, but also, it's very important for partnerships themselves. Number one, for assessment. So it's to help partnerships assess how are we currently doing things? How are we implementing these initiatives? How do we really go about embedding change? And how do we think about that right from the start? Evidence, trying to get partnerships to really think about whether this partnership approach is really having lasting benefit or not. But also for learning. And it's really about building both individual and institutional learning towards best practice. So when myself and Emma were conceptualizing this work, we felt there were like 3 key tiers of evaluation. And I think the ones which we're very familiar with is the first one, where you're looking at the effectiveness of the partnership intervention. And that's where we've got our log frame, we have our theory of change, we have our standard project M&E tools, which are specific to that intervention. Then we also, I think when we're looking at institutional health partnerships, we have these quality of partnership principles and standards. That talked about them. Esther, the Esther Alliance has its quality of partnership charter. But what we felt was the missing piece, and this is something that we discussed a lot with the Alliance, was about how do we really have a tool which looks at the lasting benefit of this approach. And this is where we developed the Esther Effect tool, which is what you have a copy of now. And the important thing about this one is that it's complementary. It's not in place of routine project monitoring and evaluation. It is content neutral in terms of the specific technical intervention. So whether you have a project which is looking at mental health, whether it's looking at community health, whether it's looking at palliative care, you can still use this tool because it's looking at how you are implementing, how you are trying to embed and sustain change. And so it aims to measure best practice, as I said, in this implementation, capacity building, and the embedment, and really looking at what those benefits have been. So it is generic. So when we went about developing this tool, we're also very cognizant of the fact that some of these partnerships are very small. They don't have a lot of money, and people are giving a lot of their time voluntary to do this kind of work. So whilst we want to have a tool that is scientifically rigorous, we also had to be pragmatic, because it's adding yet another tool on top of routine project M&E and goodness knows what other requirements there are. So we did do, as consultants do, a very rapid comprehensive literature review. We looked at what kind of frameworks and indicators are already being used, both from the published and the grey literature. And we looked particularly about looking at capacity development, workforce development, institutional strengthening and health system strengthening. And the key thing was really to come up with something which could be feasible, applicable, and easy to use. Because there's no point in developing yet another tool if people have a look at it and they feel, oh, there's no way I'm going to manage this. We also used the health system strengthening cube and the thinking behind that when we were looking at the types of indicators. I think all too often, lots of projects are very good at providing support, the inputs. Let's do some training, let's buy some equipment. But they're not looking deeper in terms of what are the kinds of indicators we need to look at to really strengthen and bring about change. So it's looking at those performance drivers. So we were trying to go a bit deeper than just those inputs measures. So what does the tool look like? You have a copy of it. It's modular. The first section is on implementation best practice. It then looks at the different ways you can embed change, looking at curriculum development and use, reach capacity building, best practice, whole institutional strengthening. And then it also looks at the added benefits, both to the individual coordinators and to the institution as a whole. Someone asked a question about training of trainers, and we have quite a nice one on page, I think it is on page 3, about the ability to develop capacity building. And you'll see that there's a range of responses from, we're really at the start of trying to look at the best ways to do this to working towards best practice. I'll give you an example here. This is in the first section about implementation best practice. And what we've tried to do, rather than just have a Likert scale from 1 to 5, is to give a graduated responses so people can really see, this is where I'm at now. This is where we could be heading towards. So it is a learning tool as well. It's not just about ticking a box from 1 to 5. These are the kinds of themes that we have covered. So in terms of embedding change, you can see a real range of areas, from looking at the curriculum reach, how curriculum is updated, how training is delivered, the range of different approaches to implementation best practice, how harmonised are you with other initiatives, how aligned are you with national policies, with regional policies, and then looking at the kind of added value of the benefits. So we've piloted this tool across a range of partnerships, both with THET and with the Esther Alliance, and it's quite nice to see that some of the partnerships who were involved in the piloting are here today. This tool takes about 20 to 40 minutes to complete. Normally, we ask just the northern and the southern coordinators to do it because they're most knowledgeable about the process. And as you can see, we piloted it across 4 countries with equal representation from both northern and southern partners in a very diverse range of partnerships, from those who are working regionally in several countries to those who are working in smaller partnerships. Just a few quotes. I was really motivated to complete the tool as I was learning from it. I'm not a global health expert, but a clinician who works in global health. I really began to start understanding how I might measure things. The rubrics were really educational when completing it. So this really captures the thing about learning. Another nice quote from a southern partner. This will help us focus on sustainability, to really look at how much is being taken up by the local team, and to really look at whether we are impacting on one area or the whole facility. We need to ensure that what we do is escalated. Using this as a self-assessment, it will help us focus on what we want to achieve. So what do the outputs from this tool look like? This shows you and you probably can't read this at all, actually. I really criticise people when they put up slides like this. But it shows how if people get the same response, there's a number, and you can see whether if a northern and southern partner agree or have a disagreement. So you can see whether people agree or disagree. And so this provides a very good forum for discussion. And I think Rosemary's going to be talking about this after her experience with completing this tool. You can also see, when you look at a whole domain such as the implementation best practice, across the range of indicators that we're measuring there, and the partnership can see at what level they are performing from 0 up to 4 in terms of best practice. So again, a really nice way of very easily being able to see. This tool can be administered once a year, so you can see progress with time. So in terms of the usefulness and relevance, I think certainly there was unanimous. The partnerships were very unanimous in terms of its relevance, irrespective of the technical project intervention. That was really important. It provided this opportunity to discuss differences and perspectives. Often we think we know what each other are doing, and actually by getting the both northern and southern partners to complete this independently, it allowed them to see whether or not those perspectives were aligned. Great opportunity for learn sharing and also for giving insights for working towards a more advanced level. I think also there was a strong appreciation on the focus of really trying to capture these measures of sustainability. So in conclusion, we found from the pilot that the assessment tool is acceptable, relevant and useful. The paper-based version is available now, you have it. The online self-assessment tool, Esther's working on making this available from early 2018. That will also produce the output reports as well, which will be really useful. And again, we're discussing with Esther still about further research so that we can then start evaluating portfolios of partnerships, which I think for FET, for the Alliance, these are things which are really interesting to really try and then understand why some partnerships, why they're better at sustaining and embedding change than others. So thank you very much. And then Emma will answer all the really difficult questions.